Hello everyone, I am Dr. Jacques Conradie from the Department of Neurosurgery at Kimberley Hospital in South Africa. Most, if not all clinicians viewing this video have encountered adult lumbar disc herniation in their practice. It is a common entity having a lifetime occurrence of up to 40%. However, few, if any, have seen it in a child. Pediatric lumbar disc herniation is a rare entity with only a handful of cases described in children under the age of 10 years old. It differs from adult disc herniation in many aspects, including presentation, etiology, and best management plan. Here, I present a case of lumbar disc herniation in a 1-year-old that was diagnosed on MRI with uncertain etiology. It will be followed by a short discussion of some key points. A 1-year, 8-month-old girl was brought to the hospital by her mother. The mother reported the child to be healthy with no previous medical or surgical history, essentially a healthy girl. The presenting complaint was that her daughter was refusing to walk and noted to be extremely irritable. These symptoms started earlier on that same day. There was no history or signs of trauma present, and there is no history of previous or similar episodes. Upon examination, the child kept her right leg straight and externally rotated. Further, the child was noted to have loss of lordosis. When attempting passive movements on the right leg, the child would start crying as if to be in extreme pain. Blood results were mostly normal, but showed a slightly raised CRP and an iron deficiency anemia. X-rays of the hips, legs and spine showed no obvious pathology, and at this stage the diagnosis was unclear. An atypical presentation of septic arthritis of the right hip was the working diagnosis at this stage. An MRI of the hip joints was done to confirm whether it was septic arthritis. No septic arthritis was seen, but the MRI revealed what seemed to be herniation of the nucleus pulposus of the L3-L4 intervertebral disc. But as can be seen on this image on the left side, there is no spinal cord or chorioequina compression. But when one looks at the axial image, as can be seen on this right-sided image, there seems to be nerve root compression when compared to the opposite side. These are two sagittal view MRIs. The right side demonstrates compression of the nerve root as it exits the neural foramina. When compared to the left side, one can see significant decreased CSF space. Finally, an assessment of disc herniation of the L3-L4 intervertebral disc was made, but the exact etiology was uncertain at this stage. Conservative management was attempted with analgesia and physical therapy. She responded well and started walking again after 2 weeks. Her mood improved and she seemed less irritable, though it was noted that she still had loss of lordosis and an abnormal gait, never bending down to pick up objects from the floor. She underwent physical therapy and continued conservative management. On her 3-month follow-up, she was back to normal according to the mother, able to walk around and bend to pick up objects from the floor. Unfortunately, she has missed the follow-up dates and we cannot comment whether she is still symptom-free, and we do not have a follow-up MRI to assess whether there is resolution of the disc herniation. The etiology of pediatric lumbar disc herniation seems to be multifactorial, related to trauma, degenerative changes, genetic predisposition, and associated factors such as scoliosis. The clinical diagnosis in children is difficult, as they cannot explain their symptoms and examination is challenging, especially in children under the age of 10. Therefore, they mostly present with irritability and difficulty walking. 37% of adults over the age of 60 have asymptomatic lumbar disc herniation or an incidental finding of lumbar disc herniation on an MRI. But if lumbar disc herniation is seen on a pediatric scan, it is likely to be symptomatic and clinically significant. Conservative management seems to be less successful in children under 10, with all 9 cases requiring mastectomy after failing conservative management. This could be related to the pediatric disc being well hydrated and difficult to resorb when compared to the dehydrated adult disc. Though this case did not require surgery, the follow-up was short and no follow-up MRI is available. Lumbar disc herniation is rare in children under 10 and should be viewed in a different light than adult lumbar disc herniation with regards to etiology, presentation, and best management plan. Though in adults conservative management is the better option, this might not be true for pediatric disc herniation, but further research is required.